Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today, we provide essential suggestions for seniors that cannot be overlooked. Over 50. The Anti-Sarcopenia Plan. Functional moves that strengthen senior wellness. A new way for folks over 50 to work out is growing increasingly popular. This paradigm, based on research on coordinated functional strength in non-human primates, rejects high-risk, heavy-load gym routines in favor of low-impact, joint-protective movements that improve the practical strength needed for daily tasks. The main point is that the body's integrated and coordinated musculoskeletal systems are not being used enough, which is what causes the loss of strength, mobility, and resilience that is commonly blamed on becoming older. This report outlines the theoretical rationale for this methodology, selects 5 essential movements based on their safety, scalability, and direct relevance to practical tasks, conducts a thorough analysis of their biomechanics and implementation, and concludes with practical suggestions for integrating them into a sustainable regimen aimed at preserving independence and enhancing quality of life in later years. Beginning and reason. In today's world, people don't do as many different kinds of coordinated multiplanar movements as they used to. Long periods of sitting, few activities at work and home, and less need to lift or climb reduce the stimuli that are necessary to maintain neuromuscular coordination, joint flexibility, and overall strength. On the other hand, monkeys in the wild show that coordinated full-body actions like climbing, pulling, and hauling may help build strength and joint resilience without the requirement for particular resistance training. The goal for older people is not to have the same strength as non-human primates. Instead, the similarity shows an important principle. Functional strength comes from coordinated full-body motions, not only from growing individual muscles. When general movement patterns become worse, many everyday chores, such getting up from a chair, getting out of bed, moving groceries, carrying luggage, or getting back to normal after a disruption, become harder. People over 50 may not benefit from rehabilitation and preventive therapies that focus primarily on strengthening one joint or on high-intensity, technically difficult lifts. Training that focuses on compound movement patterns that are similar to how we move in our everyday lives, done in a manner that protects the joints and gradually increases the difficulty, may build capacity with less risk and a better return on investment in terms of function. This program is based on 5 basic movements that are meant to help the body work as a whole again. You don't need much particular equipment for each workout, and you may change them to fit a broad variety of skills and health issues. They all want to improve muscular force production, power, speed of force generation, posture, balance, coordination, and joint stability. The next part explains the physiological reasons for this method, and then goes into great depth on each movement, including its goals, functional importance, biomechanics, steps, regressions, and progressions, technique cues, and common faults. The latter portions talk about safety, clinical concerns, program, structure, progression procedures, result assessment, and useful ways to improve adherence. Musculoskeletal decline, sarcopenia, which is the slow and widespread loss of skeletal muscle mass and strength as people become older, is a major cause of decreased functional independence. Epidemiological research demonstrates that muscle mass often declines throughout midlife, with a significant acceleration occurring around the age of 60. This decline results in functional impairments such as decreased gait velocity, difficulties in transitioning from sitting to standing, worse balance, and an elevated risk of falls and fractures. Sarcopenia is mechanistically multifactorial, characterized by the loss of motor units, denervation and incomplete reinnervation, selective atrophy of type 2, fast twitch fibers, anabolic resistance to dietary protein and exercise stimuli, hormonal fluctuations, decreases in growth hormone testosterone, and estrogen inflammation, and diminished physical activity. Along with losing weight, neuromuscular factors have a big effect on how well you can perform. The aging process is associated with impaired motor unit recruitment and firing rates, reduced force generation rates, diminished intermuscular coordination, and altered proprioceptive sensitivity. These changes in the brain make it harder to respond quickly and make it harder to go back to equilibrium. So treatments that work on hypertrophy neuronal coordination, power the pace at which force is produced, balance and integrated motor patterns, are likely to make daily life better. Walking and biking are examples of traditional aerobic exercises that are good for the heart, but they don't always provide the mechanical stresses needed to stop or reverse sarcopenia. Resistance training is the best way to keep your muscles strong and big for the rest of your life. However, heavy barbell lifts and plyometrics done at fast speeds may make people anxious or not be good for those with joint degeneration, osteoporosis, or a low ability to recover. Functional strength training meets this demand by focusing on complicated multi-joint exercises that simulate normal tasks, improve neuromuscular coordination, and reduce excessive shear or compressive pressures on the joints. For elderly people, a movement-based functional approach has several advantages, such as improved neuromuscular coordination. Functional movements help the nervous system recruit and coordinate motor units across different parts of the body, which improves proprioception, reaction speed, and balance traits that lower the chance of falling. Preservation of power training. Ballistic or explosive hip-dominant patterns maintains the tempo of force generation, making it easier to make quick corrections. Better core and posture stability. Compound actions require the trunk and pelvis to be stabilized in a coordinated way, which protects the spine and makes it easier for force to be transmitted. High transferability to daily life. Functional training mimics the demands of everyday tasks, giving participants clear benefits for independence that they can clearly see, which encourages them to stick with it. Needs little equipment and can be scaled up or down. These movements can be changed for locations with little resources and can be done by anyone with a wide range of skills. The 5 exercises below: wall pull, sit to stand power lift, hip hinge power swing, loaded walk, and seated rope pull with leg drive were selected based on these rules. Each one focuses on a basic movement pattern: horizontal pulling, hip hinging, explosive hip extension, loaded ambulation, synchronized upper-lower pulling, and has detailed instructions on how to use it and clinical issues to think about. Exercise 1. Wall pull modified inverted row. Goal: improve thoracic posture, spinal stability, and posterior upper chain, upper back muscles, scapular stabilizers, and forearm grip. Functional value: pulling horizontally helps open heavy doors, pick up items, back up a lawnmower, and transfer. Long-term sitting causes thoracic kyphosis and scapular protraction. Strengthening the posterior chain may prevent postural alterations and relieve shoulder and neck discomfort. Pulling quickly improves grip strength, which is linked to older adults' health and death. As an inverted row with a less steep angle, the exercise is biomechanically and neuromuscularly feasible. The major shoulder extender and adductor is the latissimus dorsi. Biceps and forearm flexors bend the elbow and strengthen grip, while the rhomboids and middle trapezius pull the scapula back, and the posterior deltoid pulls the arm horizontally away from the body. Closed chain orientation isometrically trains the core and gluteal complex to firm the torso and transfer force along the kinetic chain. Eccentric phase strengthens shoulder and reduces tension. What to do and how. Set up a chest-level safe anchor. A permanent bar robust door with a towel wrapped around the handle or horizontal rail may achieve this. Have a strap or suspension trainer use it. Grip should be neutral, palms facing each other, or pronated depending on comfort. Initial stance: back up until arms are fully extended and body is planked. A steeper angle closer to horizontal increases weight. Maintain a straight line from head to heels. Use gluteal and abdominal muscles to prevent hip slumping and lower back hyperextension. Draw. Pull your shoulder blades together, then draw your chest into your hands with a straight neck and tight elbows. Avoid over-raising your shoulders. Take a rest at the peak to increase time under tension, then slowly descend for 2 to 3 seconds. Breathe out while pulling in when lowering. Progress and size. 3 sets of 8 to 12 repetitions. 2 to 3 times a week is recommended. Reduce your body angle or conduct partial range pulls if you can't accomplish many excellent repetitions. Increase the weight or reduce the angle to horizontal. Extend the eccentric phase to 4 to 5 seconds. Use single-arm variants to train the core. Add a weighted vest if needed. Regressions and clinical effects. For shoulder discomfort, start with scapular retraction and pain-free range of motion before increasing resistance. Keep the rotator cuff safe with elastic band retraction and external rotation workouts. Use straps or a neutral grip bar to reduce forearm stress for inadequate grip strength. Common errors. Focus on scapula engagement and chest movement with a biceps-dominant pull and early elbow flexion. When shoulders rise toward ears, scapulae are depressed. Tell them to tilt their pelvis back and engage their glutes if their hips are dropping or their lower back is hyperextending. Improvements in posture, scapular control, grip endurance, and functional horizontal pull capabilities frequently occur within weeks of constant exercise. Sit to stand power lift, a spin on trap bar deadlift, goal build gluteus, maximus hamstrings and quadriceps, strength and endurance, while maintaining a safe hip hinge and stable lumbar region. The capacity to change seating postures is essential to autonomy. Sitting to standing shows a person has problems moving and is at risk of falling. This motion is like standing, therefore training is job-specific. Biomechanics. Hip dominance is emphasized. The spine remains neutral. The hips swing back and the legs provide concentric force via hip and knee extension. Weights in front of the body put more shearing stresses on the lumbar spine than weights held to the side or with a trap bar. Trunk stabilization and force transmission need core activity. Directions and methodological prompts. Getting ready. Stand on a solid platform that is the right height, such a chair or box with your feet approximately hip-width apart and your shins virtually vertical. Keep the weights even at the edges, or utilize a trap bar if you have one. Move forward on the seat to shift weight to the feet. While keeping your spine straight, bend your hips a little. Engage the midfoot and heel and extend the hips and knees in a coordinated motion to rise, focusing on a strong contraction of the gluteal muscles at the top. Descent. Bend your hips and control how much your knees bend to lower yourself gently. Don't drop suddenly. Keep your hips and core tense as you go down. Breathing. Take a deep breath before you lift and let it out at the top of the lift to keep the pressure in your stomach without holding your breath. Size and progress. Suggestion: 2 to 3 times a week. Do 3 sets of 6 to 10 planned, controlled repetitions. Put quality of movement ahead of load. Regressions. Take away the burden, raise the seat height, utilize arm support or aid from a caregiver, or do partial stand-to-sit moves to boost confidence. Progressions. Lower the seat height to need a broader range of motion. Gently add a little load. Do a one-sided sit-to-stand to fix limb asymmetries. Slow down the eccentric phase to increase duration under stress. Changes for safety and health. For knee osteoarthritis, focus on distributing the weight through the hips, avoid moving the knee too far forward beyond the toes, and control the descent. First, think about a shorter range and higher seats. For lower back pain, keep your spine straight and limit how much you bend your trunk forward. Use less weights and only go on when your form is good. Common errors. To get up, generally extend your knees and just bend your hips a little, squat method. Tell them to move their weight back and push their hips forward. Rely on momentum or quick oscillation propulsion that is controlled by cues and planned. For persons with high blood pressure, suggest breathing patterns that are controlled and avoid holding their breath for lengthy periods of time or using the Valsalva maneuver. Expected results: faster and stronger sit-to-stand movements, stronger lower limbs, and more confidence while moving from one place to another. Exercise 3. The hip hinge power swing. Kettlebell swing with a twist goal. Improve explosive hip extension, dynamic balance, and core stability, and provide the body a quick boost in metabolism. Functional significance power, especially quick hip extension, decreases more quickly than peak strength as we become older. It is also very important for tasks that need quick corrective responses, such preventing falls going upstairs and starting to walk. The kettlebell swing improves the speed of force production and coordination between muscles in a useful way. Biomechanics. The swing is a ballistic hip hinge in which the lower body provides force by making the gluteal and hamstring muscles work together to move the instrument while the arms guide it. During hip extension, the trunk has to bend, and during deceleration, it has to take on load. The unusual way of loading between the legs shows how strong the posterior chain is and how well it can slow down. Instructions and methodological prompts. Setup. Stand with your feet a little wider than hip width apart and your toes pointing slightly outward. Put a light to moderate weight on the floor. The first load must make it possible to do high-quality, explosive repetitions. Hike bend at the hips, while keeping your back straight and your knees slightly bent. Hold the instrument with both hands and pull it back between your legs to create pre-tension. Pop. Do a quick hip extension, or pop, by pushing your hips forward to raise the object to chest level. The arms don't do much. Return. Let the implement drop in a controlled way, turning at the hips to slow down the velocity through the back chain, and then do it again. Breathing. During the hip thrust, breathe out strongly to keep your body in harmony. Size and progress. Prescription. 3 sets of 10 to 15 repetitions with full recovery between sets, 60 to 120 seconds to maintain the quality of power. Regressions. Before moving on to ballistic swings, work on your hip hinge with unloaded exercises such good mornings or Romanian deadlifts with a light dowel, or band use less weights, or practice two-handed dead hold swings with a restricted range. Progressions. Slowly increase the weight while keeping the speed and form the same. Use single-arm swings to make the rotational and stability issues harder. You may also add pauses at the top for isometric control. Concerns about safety and reasons not to use it. Don't use it if you have uncontrolled high blood pressure, have had a heart problem recently, or have severe osteoporosis with a weak spine, unless your doctor says it's okay. People who have had hip replacements should talk to a doctor or physical therapist about what weights and ranges are safe for them. Common mistakes. Use squatting instead of hinging to focus on hip posteriorization and restrict knee flexion. Use your shoulders and arms to lift things. Make sure your hips are strong and your shoulders are relaxed. Don't round your lower back. Always keep your spine in a neutral position. Expected outcomes: more explosive power, a faster start to the stride, a stronger posterior chain, and a bigger heart when done at moderate volumes. Exercise 4. The weighted walk. Modified farmer's carry goal. Improve overall strength, grip endurance, core and postural stability while carrying a load and functional work capability. Functional significance. Carrying things like shopping bags, baggage and laundry is something that most people do every day. However, some older people have trouble with heavy or uneven loads for extended periods of time. The loaded walk gets the body ready to maintain a position and move while carrying more weight, much like other domestic chores. Biomechanics and neuromuscular requirements. The exercise requires the upper back and core to work isometrically to counterbalance torque caused by the load, while the lower limb muscles are involved in a dynamic locomotor activity. Grip strength is always assessed, and control against lateral flexion is examined when the loads are not equal. The gait sequence under stress improves stability from step to step and control of the pelvis. Directions and methodological prompts. Setup. Pick 2 things that weigh the same, such dumbbells, kettlebells, sandbags, or other household items that are similar. Put them in order by their feet. Pickup. Bend at the hips, bend. The knees, keep a straight spine and lift with both legs, not the back. Walk. Pull your shoulders back, lift your chest, engage your core, and take deliberate, steady steps while keeping your eyes ahead and without leaning to the side. Length of time. Walk for 20 to 60 meters or 30 to 90 seconds for each set, depending on your abilities and the weight you're carrying. Size and progress. Prescription. 3 sets per session, 2 to 3 times a week. Start with short distances and light weights. For regressions, lower the weight and distance. Do double top carries with smaller tools, or static holds, standing carries to build up your basic endurance. Progressions. To make balance harder, gradually add weight increase distance or time use uneven loading, like carrying a luggage, or do the exercise on different surfaces. Concerns and mistakes in the clinic. Fatigue-related postural deterioration is common. Watch for shoulder elevation and placement of the head in front of the body. For those with heart problems, keep an eye on their exertion levels and blood pressure responses. If you have trouble with balance, work out with someone else and start with shorter walks or get assistance. Expected results: better grip strength, improved stability in the torso when moving, and more confidence while carrying things about the home. Seated rope, pull with leg drive, modified rope, climb objective. Use upper body pulling and lower limb propulsion to enhance whole body coordination, kinetic chain efficiency, and neuromuscular system timing for complicated activities. Functional significance. Carrying stuff upstairs, getting up, or pushing and pulling need coordinated arm and leg movement. This sitting version securely simulates climbing mechanics by concentrating on interlimb coordination and force transmission without body weight vertical ascent. Biomechanics. The leg press employs the kinetic chain to send force to the trunk, making upper limb pulling simpler. Each lift engages the latissimus dorsi biceps and grip. Leg drive exercises quadriceps and glutes. As a synchronous conduit, the trunk needs core stability and temporal accuracy. Signs and instructions. Sit on a firm chair with your feet flat. Attach a sturdy rope towel or resistance band to an overhead anchor. Straighten your body and engage your core to start. Keep the rope taut by pulling with both hands. Execution. Push down with the foot on the opposite side of the body against the floor. During each hand, pull alternating or ipsilateral patterns depending on the aim. Time is crucial. Leg propulsion must meet arm pull to approximate climbing rhythm. Return controlled hand over hand, return to the starting position. Progress and size. 3 sets of 6 to 10 full climbs. Each climb includes an entrance and exit. 2 to 3 times a week is the prescription. Use lighter bands or less motion for regressions. Pull with both feet simultaneously to reduce coordination. Progressions increase the band resistance or rope diameter. Conduct the exercise from a semi-squat to challenge your posture. Add unilateral leg drive to challenge your cross-body coordination. Standard errors and clinical issues. By neglecting the legs, the kinetic chain loses its advantages. Focus on harmonious timing. Instead of slumping, raise your chest and stabilize your core to improve trunk transfer. Too much speed reduces neuromuscular coordination. Start with concentrated, moderate repetitions. Enhanced limb synchronization. Integrated pulling capability and application to composite upper and lower limb activities are expected. Safety and clinical assessment. Even though the exercises are mainly low impact, establishing a new fitness routine in middle age or later demands caution. A brief pre-participation checkup should check for cardiovascular risk, recent surgeries, or fractures, symptomatic joint condition, and balance issues. If you have recently had surgery on your spine, knee, or shoulder, severe osteopenia or osteoporosis that puts you at risk of vertebral compression, uncontrolled hypertension, or arrhythmias, unstable angina, or significant balance problems that make standing up dangerous, see a doctor or licensed physical therapist before starting. Participants must be taught to distinguish apparent exertional pain from acute tissue damage, nociceptive pain. Acute penetrating or joint-specific discomfort necessitates quick rest technique, adjustment, and medical examination if it persists. Assess hemodynamic responses in cardiovascular disease. Patients' moderate perceived exertion. Borg 1214 is typically adequate for strength training, minimizing the requirement for maximum effort. Be cautious while increasing weight. Concentrate on technique and use the correct equipment. Neutral grip handles, secure anchoring in shoes. If you fall, often work out near supports or with a spotter until you're stronger and more balanced. Program implementation, periodization, and progression plan. To make these movements sustainable, try these concepts and program design, session frequency, and format. The whole set of exercises should be done 2 to 3 times a week on non-consecutive days to allow your body to recuperate and adapt. Each session begins with 5 to 10 minutes of mild aerobic exercise like marching in place or brisk jogging. Next practice session, relevant dynamic mobility exercises including hip hinges, shoulder circles, and leg swings. Low-weight tailored warm-ups for key maneuvers strengthen movement patterns. Start the session with the wall pull to activate the upper back and improve posture. Perform the sit-to-stand power lift to strengthen your legs. The hip hinge power swing strengthens the posterior chain. Try the loaded walk to measure core stability and load endurance. Finally, practice coordination with the seated rope pull. Technical skill-based patterns are followed by progressively complex metabolic workouts and an integrative coordination exercise. Principles of progress should prioritize quality. Only increase weight volume or difficulty if the individual maintains proper technique throughout all repetitions. Micro-progressions. Add 1 rep to each set, modify your body angle for body weight variance, or increase the load by 2 to 5% every week. Slower development promotes long-term adherence and adaptability, whereas faster growth increases risk. Use basic linear or undulating frames for periodization. For instance, 8-12 weeks of steadily increasing load and volume, followed by a week of deloading with reduced volume and intensity helps the body recuperate. To maintain maximum force and force gain, alternate weeks of strength, lower repetitions, heavier load with weeks of power or speed, lighter load, quicker execution. Volume and intensity advice. Strength focus. 3 sets of 6 to 8 repetitions with a low weight on the powerlift and loaded walk depending on strength. Hypertrophy functional endurance. 3 sets of 8 to 12 wall pulls and swings. Swings may be done for 10 to 20 extra repetitions for cardiovascular fitness. For swings and other sit-to-stand variants that emphasize power, use submaximal weights and take enough rests to concentrate on speed. Working with other modalities. On days you don't strength train, practice moderate intensity cardio workouts like walking or bicycling to enhance your heart health without impeding recovery. Balance and flexibility. Static balancing, proprioceptive activities, and joint mobility training increase movement, quality, and reduce fall risk. Use accessory exercises to improve the rotator cuff ankle, dorsiflexor, plantar flexor, and hip abductor if deficits are discovered. Regenerative and nutritional factors. To help your muscles create new protein, eat adequate protein daily. For older resistance trainers, 1.0–1.22 g/kg is advised. Larger dosages, 1.2–1.6 g/kg, may aid during active muscle hypertrophy. Sleep and recovery. Get enough sleep and allow 48 hours between full-body strength training sessions. Gentle mobility and active rehabilitation activities maintain the system without stress. Be cautious to drink enough water and know which medications may impair your exercise performance. Beta blockers may modify your heart rate. Results, evaluation and measurement use. Basic functional assessments to monitor progress and improve. A change in normal gait speed across 4 meters indicates a functional shift. Maintain or improve things. The 30-second or 5-repetition sit-to-stand test measures lower limb strength and function transfer. Timed up and go. Tug tests dynamic balance and mobility. Hand dynamometry may predict future occurrences and is altered by pulling training. Use basic questions like, how hard is it to carry groceries, to monitor functional improvements. To guarantee continual stimulation and safety record, the beginning condition analyze every 6 to 8 weeks and change program variables. Troubleshooting and common clinical situations. Knee discomfort during the sit-to-stand maneuver. Check foot alignment and weight distribution. Adjust seat height. Lessen load. Promote hip activation and limit front knee movement. Shoulder pain during wall pulls. Check for rotator cuff and scapula issues, then return to scapular retraction exercises, restrict range of motion, and go gently. If swinging causes back discomfort, examine spinal alignment, lessen weight, and add core stability and glute activation exercises. Send for a clinical checkup if symptoms persist. Reduce weight increase. Rest times reduce the walk, and concentrate on shorter, more frequent carries to improve endurance and minimize technique deterioration during heavy walks. Ways to change behavior and follow rules. Engagement is key for long-term functional gain. Improvements to compliance include education. Show how these exercises relate to everyday actions like standing up, carrying groceries, and reducing fall risk. Setting objectives. Set short-term quantifiable goals like performing 3 sets of sit-to-stands with your body weight before increasing resistance. Social support group lessons or partner sessions may keep you motivated. Simplifying the environment. Use household items as training equipment when you can't get to the gym. Establish basic checklists and progress reports. Encourage participants to log sessions, perceived effort, and functional improvements to progress. An example of case vignette. Mrs. A, 68, struggles to carry groceries and get up from a low couch. The baseline test reveals the individual walks slowly at 0.9 MES, can complete 6 sit-to-stand repetitions in 30 seconds, and has weak grip. After an 8-week 5-movement paradigm program with supervised sessions every 2 weeks and unsupervised practice, Mrs. A's gait speed rose to 1.05 ms. She could complete 10 sit-to-stand repetitions in 30 seconds, and she found it easier to carry shopping bags. Unweighted sit-to-stand exercises, 5 kilo sitting holds, and 15-second loaded walks with moderate weights are her progression. These functional benefits boost confidence and minimize fall anxiety, suggesting that tailored movement training may improve everyday activities. Final evaluation. We need a movement-based integrative strategy that emphasizes complex multi-joint patterns that mimic daily activities to center functional capacity in fitness for over 50s. The 5 movements: horizontal pulling, wall pull, sit to stand, hip hinging, sit to stand, power lift, explosive hip extension, hip hinge, power swing, loaded ambulation, loaded walk, and coordinated pulling with leg drive. Seated rope pull were chosen to work on physiological factors important for independence, muscle mass, and strength, power, neuromuscular coordination, balance, and joint stability. They provide a feasible and scalable approach to sarcopenia and degeneration that reduces joint stress and technical complexity. With the correct assessment, thorough technique training, and a focus on nutrition and recuperation, this progressive tailored strategy may enhance functional strength and confidence, minimize the chance of falling, and raise daily living capacity. Future research should examine systematic comparative trials of functional outcomes, adherence, and long-term maintenance in diverse older populations, but current principles offer clinicians, therapists, and fitness professionals a safe and effective framework. An effective 8-week beginner program technique focused weeks 1 to 2 every other week. Warm-up, walk fast for 5 to 8 minutes, then conduct mobility exercises. Wall pull, 8 repetitions, 3 sets upright. Sit to stand, 3 sets of 8 repetitions on an elevated seat. Hip hinge, 3 sets of 8 repetitions, beginning with unweighted hinges and progressing to light swings. 3 sets of 30-second holds or lightweight walks are termed loaded walks. Slow, intentional series of 4 ascents. Keep technique, breathing, and pace in mind. Progressive loading, buy to try weekly weeks, 3 to 6. Wall pull, 3 sets of 8-12 repetitions, lower angle. Sit to stand 3 sets of 6-8 repetitions with minimal weight. Hip hinge swings, 3 sets of 10 at moderate pace and resistance. Loaded walk, 3 45-second lightweight walks. Seated rope. Pull 3 sets of 6 climbs, band resistance increase. Every week advance somewhat. Power and capacity. Every other week weeks 7 to 8. Wall pull 3 sets of 10 to 12 repetitions, one or both arms. Sit to stand 3 sets of 6 repetitions at a lower seat height, moderate resistance and steady speed. Swings 3 sets of 12 to 15 repetitions, power through. Loaded walk 3 60-second sets with increasing weight or distance. Seated rope. Pull 3 sets of 8 repetitions, tougher each time. Take a week off exercises every 8 weeks if needed. Checking recheck gait speed. Sit to stand ability and grip strength at week 1 and 8. Based on participant feedback and program effectiveness, adjust future programming. This enhanced mobility program preserves the body's integrated mechanics and reduces avoidable risks. This keeps elderly individuals autonomous and able to accomplish things. Thank you for watching the video. Please let us know your thoughts and goodbye for now.